Here we have the down athlete on the field at this point. The training staff may have already removed pads, or if our crew comes up, we'll do a quick ABC assessment, make sure there's no significant life threats, and then we'll proceed with just a quick neurological exam, checking sensation and motor function in all four extremities. And then at that point, either start removing pads if they haven't been removed already. As you can see, we already have someone with maintaining inline spinal stabilization during this, and then as our crews come on, we can start the process.
So we're having right arm numbness down the arm, and as well as some pain and tingliness in the neck.
Okay. Are you breathing okay? Yes. Okay. Having any pain in place also in that shoulder? Okay, just your neck.
So our crews assess basically the chief complaint and the associated symptoms, and we found that there's some right arm tingling and some pain as well. So we're going ahead and placing a properly fitting collar, making sure that the collar itself is fitting. Some may need a no-neck collar, but we may need to make some adjustments there so we're not hyperextending the neck or hyperflexing the neck depending on the situation.
So what we're going to do is we're going to get it scooped and we're going to put it around you to put you in the pot, okay? So at any time that hurts, let us know and we'll stop you and do it differently. Okay?
All right, so now the crew's going to bring in the scoop stretcher. This will basically break in half so we can place it on either side of the patient. Again, at this point, we've preferred to have the equipment if possibly removed so it doesn't flex the athlete forward at this point. So the crew's measuring the scoop for the height or the length at this point of the athlete, and making sure that that it's going to be the proper length, and that the feet and the head won't hang off and will be centered inside the stretcher. And so to break down the scoop stretcher, there's a small button right inside that clip, and we can use that to actually break it apart. It's not a tugging motion. You actually have to engage that on clipping to do it.
Still doing okay?
So if the extremities are spread apart at this point, we're bringing everything into the core so we can fit onto the scoop stretcher and starting to essentially move it together slowly. And clip it together. It's important to tell the athlete to not assist in this. This is basically all of us doing the work in this way, and then slowly collapsing it together for the clips to engage. For female athletes or other male athletes with long hair, it's important to try not get the hair clipped into the scoop stretcher itself on that top clip. Just an important safety tip as well.
So we're going to get you lifted up and moved.
And then we have both straps on the athlete now, making sure they're tight, making sure also that chest clip is not too tight to restrict basically ventilation and being able to have a chest rise and fall.
Fine.
Okay. Okay.
So we're going to pick you up. We're going to place you on the stretcher, okay? All right, I'm ready. 1, 2, 3.
All right. Now our crew is basically doing a team lift onto the stretcher on count.
Yep. 1, 2, 3. All right. Disconnecting the
Yep.
head.
Okay.
Undoing the strap. Okay.
So at this point, we're doing a pretty quick, easy removal of the scoop stretcher. Again, pressing that button inside that clip to disengage it, making sure your straps are off, and then peeling it away. So it's important that we actually remove these before transport. Again, it helps the cot pad that patient, and so that way, with any kind of bumps or jostles in the road, this cot is essentially absorbing some of that impact and is actually helping protect that spine as they kind of sink into that stretcher. There is part of the reasons we remove it. Again, it also is reducing pain and other pressure points for the athlete in that way, so and increasing the comfort of it at this point. And so the crew may opt to use tape on the head, or they may also use some towel rolls at this point to help remind to minimize movement of the head, but that's an optional point But in general, we don't expect that we continue spinal motion and holding the head the entire time all the way to the hospital. We generally consider the C-collar at this point to be protective in that. And as a reminder, as we move to the hospitals, continuing that spinal alignment and doing an easy handoff is usually what we expect, usually with either a slide board or a sheet pull across. And so that's the general procedure.